Good morning, my name is Jacqueline Sullivan and I'm from the University of Adelaide, and today we're going to do a video for educational purposes on fractures of the upper limb. So next we need to make sure we position our patient correctly. So we pop their elbow on the little pad we've got here and we start to face the patient. This gives you the ability to see all around the arm when you're actually casting. While we're in this position, we want to make sure that we've got the right patient as well, so we check our name and that we've had a look at the x-ray. The next part that we want to do while we've got the patient's arm resting on this rest here is that we're looking at them for neurovascular status. So we're feeling for the hand to check that it's nice and warm and not cool. We're checking that the skin is intact and that there are no wounds. We make sure that there are no bony prominences, such as if this patient here was to bend their elbow into the Colles position, the ulnar head here does pop out a little bit and becomes quite prominent. So we need to make sure that we pad that up. So that's one of the things we need to be aware of. We also need to look to make sure that there are no rings, no IV lines and no wounds. So once we've established all of that, we can then proceed to the next step. So the next step is actually getting all of our products ready. So what we have here is a ProTouch stocking, and this is a cotton stocking. We need to measure this quite carefully because as you put it onto the limb, it will shrink down. So we put our patient into the position we want, and the position we're going to do is called a handshake. So we get the patient to shake hand with us if that's possible, and we get to leave them in that position. That's your final position that you would want for this cast. So we take our stocking and we just straighten out the fingers, and we need to measure from fingertips down to just past the elbow tip. And we'll just take a little bit of that excess off, like so. So we just bunch this up into a roll and then just pop it over the tops of the fingers. Don't go down any further just yet because we're needing to cut a little hole in for the thumb here. Make a little hole and bring the thumb through. Then grab hold of the stocking net and gently just unroll it down towards the elbow. So what we need to make sure is that we don't pull this piece too tight because it will cut into the thumb space, so we just make that a little bit wider like so. And you can see this is a size 2 ProTouch stocking, and it's really, really good because it's actually leaving no creases. It fits most arms really, really well. The next piece is we're going to pop a little piece of the ProTouch again over the top of the thumb. This is to give us good padding between the index finger and the thumb and around at the base of the thumb as well. So we'll take that and we will just cut a little slit down one side. We want one side to be shorter than the other, and that's because at the base of the thumb there's more skin on view and we need to cover it. So we'll just slide that down. We then take a little piece of our tape and we just secure this down, like so. And just make sure that that's nice and clean and that there's no creases in that. Next we take our soft band, and the soft band here, I usually like this size here, which is a 10, and it's actually quite better because it fits all the hand without any gaping holes. So now I take the soft band and I make a little fold, like so. And this fold should actually be round about the width of the patient's palm. So we take that little fold, and again we don't want too much material up in here, so this will be narrow. Not too big a hole as you're cutting through. So we've got a thinner piece here, which will go in between this web space and the wider piece at the bottom. So we take this and we make sure that we've got the roll the right side up. So in our teaching terms, we say this is a live snail. If you start to roll that way, it's called a dead snail. But so you want it alive, you want it up. And we slide that over the thumb. Now already we've got one layer of padding there already, and the actual guidelines are for 2 layers. So we come round again. We make a diagonal cut almost to the end, we come back through that web space and we wrap around. Now I'll just show you by bending the patient's arm down. We want to make sure we're clear. The reason we want to do this is if you're making a splint and you go past this area, then your splint becomes too long as well and you get into trouble. So make sure that that is nice and below the metacarpal heads there. Come round with a not too tight a tension, just a reasonable amount of tension. If you pull this material too tight, it will thin out and then it's no longer padding. Now if you remember, we were talking about the patient's ulnar head here, so we're going to make a little extra piece of padding just to stick onto here, like so. So we would put a little piece of extra padding there. So then next, once we've done that, we'll actually use our Gypsona product as our splint. So here at the Royal Adelaide, we use Gypsona for most of our splinting at the early stage of fractures, and that's to allow for swelling. So what we do here is we gather our Gypsona and we make 10 layers of the Gypsona. That's our standard format for a Charnley back slab or any upper limb back slab. So we've made our template here and we've cut it out. So we've folded this in half and then we cut out a little C shape. So there are templates in your plaster trolleys, just use those when you see them. So next we take this Gypsona, and this will warm up. So be very careful what you're doing next. We take our water, which is at room temperature. The reason it's at room temperature is because the temperature of the water and the temperature of the plaster, when it meets together, has an exothermic reaction and causes quite a fair bit of heat. So you don't want to burn your patient. So we put this in and it's a very quick dip in the water. We'll just get rid of the bowl. Let it drain, and I'm going to put it down on the bench, and the reason I'm putting it on the bench is I just want to meld in all that Gypsona into the lineo weave of the Gypsona, and we want to make sure there's no creases as well. So now we're just going to check position on our patient again, so we bring that hand down into the handshake and we take this and we place it like so. So it goes along the radial side of the arm. And the little piece that hangs in here goes in through the thumb. Now that's just to hang there. Just make sure your edges are all good, that there's no edges over the metacarpal head, you haven't gone past your plaster. Very quickly, just with the flats of your hand, not fingers. Please don't stick your fingers in there, otherwise you will cause indents and then the skin will become irritated underneath. Fold over your edges. So don't play around with this part too much, because it's going to start crack setting pretty quick. It's about 3 minutes and it will crack set on you. Get all your edges down, all your stocking edges down, like so. Then take your crepe bandage. I like to start at the bottom and work my way up. Now the reason I do this is because you're going to be going around the hand and people can find that quite daunting and complicating. So get rid of as much of the easy stuff as you can and have as much roll left over. With a good tension, come round, and we're just going to rotate that hand, come up, give that a little squeeze in through there. Again, just looking at your edges, making sure that you're not coming over the edges of your splint, as this can impair the person from using their hand if you've actually got bandages all the way up the top of their fingers. So we'll come down, and that is enough on that one. And again, we'll just put a little bit of tape there to hold that. We'll just do a little bit of moulding. We've got 3-point moulding, which starts here, and then the hand goes on the top there. So 1, 2, and then that's the third one. It's going to depend upon the length of the arms whether you'll get the third one in. And what we're doing is making flat edges to actually fit the contour of the hand. Now the reason we do this is because we want to make sure that when the patient is moving around, we're preventing flexion and extension, but we also want to prevent rotation as well. So we just hold that for a few minutes. So you should see an indent here where the cast has actually been flattened out. So we do that. Take the time to do this. This is really, really important. As you go to do things, as you're getting a little bit better and a little less pain over time of wearing this splint, is that you will stick your hand out to do that rotational movement, and this will prevent the actual fracture from moving and causing pain to the patient. So we've now finished the moulding, so that would be the third one. So what we need to check now is that the patient can bend their elbow. So the cast should be 3 finger widths down this way, which it is. Metacarpal heads should be free, which they are. They can flex up and down and the patient can bend their fingers. Base of the thumb is free. And the palmar crease is actually free for bending the fingers up and down as well. So with this now on, we would send the patient for a check x-ray to make sure that we've maintained the position. So in recap, it is important to make sure that you have the right patient, that you have the right back slab for the particular type of fracture, that you give the patient adequate pain relief prior to starting, that you gather an assistant to help you put on the back slab. Make sure you have the correct equipment ready to go. make sure that you have done a skin check. Also, a neurovascular check prior and post application, and importantly, have a consent verbally from the patient to the application of a back slab. Thank you.